Hello, everybody. My name is Caitlin McDonald. I am the co-founder over here at the Social Speak Network, and welcome to the newest episode of the Social Speak Network podcast. In today's episode, we're going to be talking about email marketing for healthcare centers. Now, a lot of times people think that email marketing is something that they can't do. They don't want to break any HIPAA compliance rules. They want to make sure that patient information remains private. However, you can still utilize email marketing to keep your prospects and patients aware of what's happening at your practice and making sure that they think of you first and foremost when either they have a symptom that they need to come into your specialist or they hear somebody else needing help and support in your specialties. So not all email providers are created equal. We typically recommend utilizing an email platform, a CRM, that is designed specifically for healthcare. There are a lot of great form builders out there that are HIPAA compliant. FormStack, JotForm, are just a few of them that do have levels that are HIPAA compliant. So that means that the information that is stored there remains secure. So you aren't breaking any rules by having people sign up through that. We always want to make sure, however, that people are explicitly stating that they are interested in receiving marketing material from you. We sometimes go a step further and add text in there in the form itself about receiving text messages regarding upcoming appointments so that you can send them text messages as well and have it just be very transparent what they're signing up for. So for example, if it's a request a consultation form, you want to make sure that you're taking those steps to also ask them if they want to join your email list rather than just assuming that requesting a consultation also means email list. The similar sort of thing for patients who are coming in the door, maybe giving you a call, not filling out one of those forms. While they're in your practice, you should always be asking them if they would like to receive marketing information from you, and then ask for their email address and have them physically sign a sheet of paper that says, yes, I'm giving this practice permission to reach out to me via email. We always want to have some sort of a form like that. Now, one of our favorite pieces of technology is called InfluxMD. And this takes this a step further. So it doesn't just create the forms, but allows you to create the forms and then track prospects as they turn into patients. So it brings a prospect all the way through to that first online booking. Now, oftentimes your admin will have forms and paperwork that they need to sign, new patient paperwork that they need to sign before coming in. And through InfluxMD, we're actually able to create systems and processes that automates this entire flow. So not only are you receiving their contact information, and gaining approval that the individual would like to receive the marketing emails from you, but you also are able to, within that same module, make sure that you are bringing a prospect into becoming a patient. So this really increases the transparency as it relates to ROI. And how much you're spending on advertising versus bringing in the door. So the goal is obviously in that first appointment to have that positive ROI. But if you think about the entire lifetime value of a patient, this also helps to increase that as well and do referrals as well. So in this case, we use kind of the CRM as that initial point up to that initial patient consultation, then they're moved over to your EMR. So it's kind of two platforms that work side and side. Admin and staff who need access to the records can have that, whereas marketers like myself just see the reports and the data coming in. So What types of emails, when we're talking about email marketing, should you be sending out to prospects and patients? I already mentioned one of them. Those are kind of status updates of your practice. So do you have a new doctor? Has staff changed? Do you have new nurses there? You want to provide that personal feel, that personal touch to your prospects so that you remain top of mind and so that they really know, like, and trust your experts. Secondly, you want to send out timely health information. Potentially you're writing blog posts, which we've covered in previous weeks, or creating videos, which we also have covered in previous weeks. And so you want to make sure that you are getting those resources and that information to individuals, and email is a great way to do that. So you're allowing them to take their health to the next level because you are providing them with those resources and the guidance to help them live healthier, more fulfilling lives. Now, the last thing is, well, I guess the last general type of email that we would recommend sending out is for appointment reminders as well as appointment follow-ups. You might see this a lot where in other industries, and it's less so in healthcare, where you receive an email requesting a review. Now, reviews on Google still are, and Facebook and Yelp are still some of the most powerful social indicators that you can see online through your marketing. People who are not familiar with your practice will actually take a look at these reviews in order to help guide their decision on whether or not they want to contact you for that initial consultation. And once they contact you, they will continue to do more research. So these reviews help to give them peace of mind. So we do recommend utilizing a software or a tool that helps to send out these follow-up emails, and it also works with text message as well, to folks who have been to your practice. So again, just as an overview of these types of emails, so staff news and information about your practice, maybe new locations, new specialties, new equipment that you have, so the kind of the press release type. Tips and health information, so this is the educational type of information. We do recommend even sending this out weekly. It's a great way to stay top of mind. And you could combine the two. If you wanted to send out one monthly newsletter, you could have the featured staff as well as that health education. And then the third one is for appointment reminders and follow-up reminders for reviews. So I hope that this has been helpful as you start planning out your email marketing strategy for your healthcare center. Again, my name is Caitlin McDonald. I'm here with the Social Speak Network, and we're just about all the way through our Q3, Q4 marketing overview for healthcare centers. This was our 10th week going specifically into a topic, but over the past quarter, we've talked about your social media strategy, Facebook advertising, Facebook groups, Instagram, Pinterest, blogging, lead generation, videos, running a podcast, and more. So if you've missed any of those and you want to dive into more detail, we have the full transcripts available at our blog. You can hop on over to our YouTube channel to view the videos, or over to Social Speak Network on iTunes to listen to the audio. Thanks so much, and I will see you next time.